So the other day, I was scrolling through social media as you do, and I saw a post where a friend was saying that she wishes her menopause came sooner. And on seeing that post, a lot of emotions or thoughts ran through my head because, first of all, I thought, oh dear, she must be going through some difficulty with her periods in some shape or form. And secondly, I also wondered, does she know what she's wishing for? Because in as much as women, we do get a tough time with periods. Some women, I'm sure some people were especially favored by the creator and they don't have problems, but most women seem to have some sort of problem with their periods. It could either be heavy bleeding, excessive pain, excessive premenstrual symptoms, the mood swings and things that come with periods. But then I also wondered, does she know that menopause is not El Dorado? It's not all confetti and roses. It comes with its own unique challenges. So in this video, I will attempt to summarize some of the issues that could happen in menopause. And if time permits, I can also talk about the things you can do to help. So, what is menopause? Menopause is when a woman's period ceases, usually due to the reduction in hormones. It commonly happens around the ages of 45 to 55, but it can also happen sooner. It usually happens to everyone who has periods, but sometimes it can also happen as a result of surgery that removes the ovaries or the uterus, or as a result of chemotherapy, which is treatment for cancer. And sometimes it could also be genetic. Now, I already said that it was due to reduction in hormones. The chief hormone here is estrogen. The estrogen is the hormone that makes you a woman. And yes, so as a result of this reduction in estrogen, you can get symptoms like night sweats, hot flushes, itchy skin, palpitations, a lot of things, brain fog, even. And mentally, apart from the brain fog, issues with memory, concentration, irritability. Some people even experience symptoms of depression as a result. And it also gives us symptoms down there. Things like vaginal dryness and low libido. Um, Sometimes people get recurrent urinary infections due to the dryness. Now, these are the symptoms I just said are like common ones, but what we don't talk about often is that this reduction in estrogen also increases a woman's risk of heart diseases and strokes because estrogen protects the heart and the blood vessels. The other thing to mention is that it also causes a reduction in our bone density. And what this means is that you are more prone to fractures because the bones are more brittle or softer. So, is this something one should aspire to? If you ask me as a doctor, I don't think so, but I guess to each their own. I suppose if one has serious menstrual issues, they will think that the alternative is to cease the periods and they will be fine. But I do not think that's the answer. If you're going through any issues with your periods, I think the best thing to do is to talk to your healthcare provider. Most issues with the periods can be dealt with by a competent healthcare provider. There are several options to deal with all the period issues. In terms of menopause and what to do to keep yourself less at risk of the complications, look out for my next video. Bye.